A resolution calling on the Kenny administration to develop a plan to be more inclusive of City Council when creating and implementing emergency public safety measures and restrictions.
And the chair recognizes Councilman O.
Thank you very much, Council President. This is a resolution requesting that the administration develop a plan that is more inclusive of City Council. I do cite that there was a decision in federal court that states that the executive must enact laws in conjunction with the legislature. That decision has been stayed. It's been appealed, and the decision is stayed pending the appeal in the Third Circuit. However, the principle is there that while laws can be made that people don't like, there is a system of checks and balances in our democracy to ensure that there isn't just simply one branch of government doing things that affect people adversely, maybe for their own benefit, that hasn't been vetted through a system of checks and balances. When COVID-19 first broke out, we had emergency measures. We did actually grant emergency powers through resolution. There's a requirement under that code section that these emergency powers be renewed through council. However, the law department tells me that the administration is going through the health code and through the state health code, and that's fine. The issue that I have is that during this time, we have gotten past the idea of opening up the Leocora Center, the Convention Center, and we are well into the issues of COVID-19. We have a better understanding of what it is, and that should inform us. We recently were notified that the administration was going to brief us on Saturday at 12 o'clock about an announcement it was going to make on Monday for restrictions that were going to take effect on Friday. I had a prior commitment, and by the way, I already read what the restrictions were, because apparently that was already given to the news and publicized. And I understand that the administration met with business leaders on a Thursday. And as a council member that represents people in this city, the first opportunity I had to actually weigh in on what I did not know was going to be restrictions taking place on Friday was Saturday at 12 o'clock. I'm asking the administration to be more inclusive. I will say that I understand that the health department, the health commissioner, is citing a CDC study that says people who tested positive for COVID-19 were twice as likely to have eaten at a restaurant. They are not saying that people who have contracted COVID-19 in Philadelphia were twice as likely to have eaten in a restaurant. They're just saying that, they did eat at a restaurant. I don't know that there's any data or evidence that the people contracted COVID actually ate at a restaurant. But okay, if we say it's twice as likely, people who have contracted it nationally were twice as likely to have eaten at a restaurant, the same CD study says that if they went to a gym, they're 500 times less likely to get COVID-19 than the average person. 500 times less likely. And that there's no correlation to going to church, to shop, to any of those things, to an increased risk in COVID-19, yet that's also part of the restrictions. I would like to know, and I don't know, and I think the issue is it proper, is it a process of democracy that we have a chance on behalf of the citizens of this city to inquire? In a city where over 50% of the people who have died from COVID-19 are African American, and they only make up 40% of the city. They are dying at a rate 30% higher than the Caucasian population? Is it because they go to the gym 30% more, eat at restaurants 30% more? Like, I am not saying we shouldn't do public safety restrictions. I'm saying this body should inquire to ensure that the answers are provided to us based on science and data, that what we're implementing is correct. What I wonder is this: does poverty, unemployment, isolation, lack of exercise, an inability to pay rent, loss of business, inability to feed your family, does that contribute? Does that correlate to an increased risk of COVID-19? Because it certainly correlates to an increased risk of health problems, drug addiction, depression, mental health issues. I don't have the answers to those questions, and simply coming out with a list of things not to do that have been done without a vetting of this body is of great concern to me. I'm introducing a resolution and requesting that the administration develop a plan that is more inclusive of this body. I will finally say that I am not clear. I live 15 minutes from Delaware County, as I often say. I've discovered restaurants and bars in Delaware County while Philadelphia was closed. If I go to a restaurant in Delaware County and sit down and have dinner with my family and come back to Philadelphia, I've still been exposed. The thing about our city is we are a city and county surrounded by other cities and counties. And I'd like to know the science, but more importantly, I'd like to know that the democratic process is being met in actuality, and hopefully voluntarily by the administration. Thank you very much.